Hello. Today we're going to review a case study that utilizes the peaceful end-of-life middle range theory. The story. You are a nurse who has just arrived on the unit for your shift. You receive report on Rose, an ornery 85-year-old woman suffering from late-stage Alzheimer's disease and stage 4 lung cancer. You learn she is terminally ill, and according to the doctors, she does not have much time left. She has no family present, and they are uninvolved in her care. She's only accompanied by a close friend from the nursing home she has spent the last 10 years in. She is unable to make medical decisions for herself due to the effects of Alzheimer's, and she does not have an advance directive, nor does she have a medical power of attorney. Thus, it is your job as a nurse to advocate for this patient to ensure a peaceful end of life. Take a minute here and think about how you would provide Rose with care. So, how can we utilize the peaceful end of life theory? Well, there are 5 outcome criteria cited by the theory, and these include not being in pain, experiencing comfort, experiencing dignity and respect, being at peace, and closeness to significant others or persons who care. There are also 16 standards of care that are associated with each of the 5 outcome criteria that we just reviewed. These can include the monitoring and administering of pain relief, including the patient and the significant other in decision making, providing emotional support, and a plethora of other standards. So thinking about the 5 outcome criteria and the 16 standards of care associated with the peaceful end of life theory, we can come up with a plan to provide Rose with dignified care. First of all, we want to ensure Rose is not in any pain. Since she's unable to appropriately report pain, we must search for any possible causes of pain, such as a surgical site. We should also review her behavior for any signals of pain, which can include something like grimacing. And lastly, we should ask her friend if they've noticed any behavior that could indicate she's experiencing pain. The PAIN-ADD scale can also be used and is pictured on this slide. This is a scale that was developed for use with older adult patients who are experiencing cognitive impairment and could very well be used with Rose. We should also offer adequate pharmacological and non-pharmacological pain relief interventions. This could include cold compresses and warm compresses or the administration of pain medication. Additionally, we should ensure that Rose has an experience of comfort. We should provide patients with comfort measures, and this could include simple tasks such as providing warm blankets, cleaning the room regularly, and assessing the patient for psychological distress. Additionally, we want to ensure dignity and respect. So nurses should always be aware of any specific cultural practices the individual prefers, and we should always approach care with a culturally competent mindset. We would also want to focus on the patient being at peace, and we can do that by monitoring anxiety levels and providing interventions as necessary. It's been found that anxiety can decrease the comfort in the dying process. We should also provide a stable environment for the patient, as this is something typically valued by patients and has been found to reduce anxiety. Therefore, transfers, discharges, tests, and readmissions should really be minimized. Lastly, we should ensure closeness to significant others and/or persons who care. We should tend to the patient's friend, as nursing staff is known to provide emotional care to both patients and their family members. We should also ensure adequate time is allotted for the friend and the patient to spend time together without being interrupted by medical staff. So, how does the story end? Well, we've just reviewed a few ways to ensure a peaceful end of life for Rose. What else could we do to promote a peaceful dying process? What do you think we shouldn't do during the dying process? These are all very important things we should consider going into the nursing field, as nursing staff will most likely encounter death in one way or another. Thus, we must be prepared to provide the best possible care for our patients, and taking the time to think through a scenario such as this will allow us to do so.